I'm so excited to be using the Neufit as part of my physical training program. I know many of my warriors are very curious about electrical stimulation of muscles because I talked a lot about that in my book, The Wahls Protocol. And so could you give us a quick overview of E Stim and how Neufit fits into the electrical stimulation of muscles?
Yes, absolutely. So I'm glad that you're getting to experience it and see some of those differences, because ultimately it's something that many times, even though we can talk about it and people understand conceptually, to really experience it is oftentimes more meaningful. So I'll do my best to explain it here for sure. And electrical stimulation as a broad category has been around for many, many years. And there's been some established benefits to electrical stimulation. It's been shown to increase circulation, shown to help muscles contract, and it's sometimes with TENS units and different things able to help modulate or manage pain. And so there's some well-established ways in which electrical stimulation is used, and there's also some limitations. And with traditional electrical stimulation, a lot of times these days, for instance, insurance reimbursements are going down because people are recognizing that you can't do as much with the traditional devices. And so one of the limiting factors with traditional devices is that most of them are alternating current. As the signal goes back and forth, it actually causes muscles to co-contract and fight against each other. And one of the issues with that is that when you turn it up to a high enough level to really make a difference, you can end up training the body to get stiffer and almost in a spasm-like state. And so the differences in our device compared to traditional devices are a lot of times are seen when you turn it up to those higher levels of current, like you're doing in your sessions at home, where even though it feels intense, there's a lot of energy being delivered because of the shape of the waveform and the unique effects that it has on the body. It's able to preferentially relax or help lengthen muscle tissue so that you can move through it. So what you're really doing is minimizing those contractions that happen, so you can get a lot of sensory input with less of that stimulus to stiffen and more to lengthen, so you can actually activate your muscles through their whole range of motion. And that allows us to do some things on the neuromuscular reeducation side that you can't usually do with traditional devices. So we're able to see people increase range of motion, help actually increase strength as well, and movement quality.